The prolonged conflict in South Sudan has adversely affected the existing health system, resulting in poor health outcomes for a majority of the population. For more than 25 years, Action Africa Help International has been implementing projects to improve access to quality health care for communities in South Sudan. Our first health project was implemented in the West Bank, Equatoria in 1990, set up to provide emergency healthcare services to communities during conflict.
The idea for forming AAH started in 1987 when the SPLA expanded the operations to Western Equatoria. When AAH entered South Sudan, I think after consulting the community, they zero in primary health care because by then that was the most important activity and the most needed service for the community.
Our health interventions are community-based and are aligned to Sustainable Development Goal 6 of promoting access to quality healthcare services.
AAH was formed during the war. We were the first to operationalize the primary healthcare services, which later on was declared as Alma Ata in 1978.
We have a strong track record in supporting the government of South Sudan to establish health systems in Yei, Munri, and Maridi counties. AAHI contributed to the National Health Sector Strategic Plan, which fed into the state of Maridi's Vision 2025.
The State Ministry of Health and Environment is working in collaboration with AAH to build and strengthen community health system, which will now take the service delivery to the people at the grassroots.
AAHI runs the Maridi Hospital, providing essential services in maternal and child health care, immunization, nutrition education, reproductive health and HIV/AIDS testing, and counseling. Collaborations with local radio stations ensure that health messages reach an even wider audience. AAH South Sudan also supports local community-based health initiatives such as the PEER project.
The PEER project has been so helpful to us in a way that they handle issues to deal with the teenage pregnancy, HIV, stroke, AIDS, drug abuse, and many more in support from AAH International.
To increase human resource in health and to contribute to improved health indicators, we manage the Maridi Nursing Training School. To date, over 900 nurses and midwives have been trained.
The School of Nursing and Midwifery train students who are recruited from all parts of South Sudan. The students come for mostly 3-year training in nursing and midwifery, and they do their placement at Maridi State Hospital.
Beyond Maridi County, we are also providing emergency services at health facilities and using mobile doctors in Munri and Yei. We are already beginning to see better health outcomes.
Women who normally deliver at home, these days you see them coming alone to deliver in the facility. So they have understood the importance of delivering in the hospital and the safer part of the hospital delivery.
Our achievements in the year 2017 have been largely because of the partnerships that we have, partnerships with shared responsibilities. We've had partnerships with the communities that we do serve. We've had partnerships with the local governments and partnerships with the donors who've provided us with our resources. This has enabled us to be able to provide programs that are responsive to the needs of the people that we do serve.
The reason why we are partners with HI for more than 20 years till now is because the way how they are doing things. We're really happy with the professional approach that they have.
My vision for the South Sudan country program is community empowerment. It was founded to work with the community to empower them so that they become self-supporting in a very sustainable way.
AAHI has more than 25 years' experience supporting livelihood-challenged communities and has other country programs in Kenya, Uganda, Zambia, Somalia, Djibouti and Ethiopia.